181 positive cases of COVID-19 in Missouri, including 18 deaths. Approximately 17,500 people have been tested so far in Missouri. While we never want to see these numbers go up, the reality is that the more people we test, the more positive cases there will be. Each day, we are doing everything in our power to expand testing and identify and isolate those with COVID-19 to help slow the spread. Director Parson is here again today to give us an update on public safety and the National Guard. Director Parson.
Thank you, Governor, and I'll be brief so we can get to the budget presentation. At the Department of Public Safety, we fully appreciate the pressures our state budget staffers are under. In this tremendously difficult circumstances, they've responded with incredible flexibility. They're working extremely long hours, and they're making a positive difference in our ability to get life-saving supplies and equipment to those we need to respond to. Thank you. Now, usually when we deal with a disaster or an emergency situation, the people of Missouri plainly see and easily understand the challenges we face. There's no missing flooded homes or waterlogged farm fields or crushed vehicles or destroyed homes after a tornado. Initially, the coronavirus wasn't only an entirely different type of emergency, we couldn't fully understand the threat it posed or the extent of pain and devastation it would bring. Now, this tremendous threat is visible, and the anxiety of some of our neighbors is unmistakable. And Missourians are responding with the generosity and concern for their neighbors we've seen so often before. Social distancing may have eliminated handshakes, but it will never eliminate the helping hands in Missouri. There's also a malicious element that is set out to seize upon the anxiety among our neighbors to launch misinformation campaigns. They're playing on the stress to sow discord. Specifically, counterfeit flyers have been circulating claiming the National Guard is being dispersed nationwide along with the active military to quarantine the entire nation. These are flat-out lies. They're designed to confuse and create dissension at a time when Missourians are uniting in the effort to overcome the COVID-19 pandemic. The Missouri National Guard has a total of 4 teams of 4 people, each who've been traveling across the state to assess locations for potential alternate care sites to support the medical community in the fight against COVID-19. These 16 Guard members are engineers from the 635th Fest M, which is a forward engineer support team. They are leaning forward to help their friends, neighbors, and families. Their main goal is to serve and care for the members of our communities while maintaining readiness. We're all working to help, and that's why Governor is holding these daily briefings. We want to have accurate, reliable information. So don't believe rumors. Don't pass them along. Go to trusted sources that you've relied on in the past for information. Be aware these efforts could be flyers distributed in a neighborhood or sophisticated cyber campaigns, but the objective is the same, to seize on people's anxieties in order to confuse. Don't be fooled. Reach out to law enforcement in your local area if you have questions. One final update. I've had some new numbers from the Strategic National Stockpile shipments today. The team has shipped out 62,000 N95 respirator masks. They've also shipped out 75,000 surgical masks and 10,000 surgical gowns. Since this effort started, Missouri's Strategic National Stockpile has shipped over 8,000 total cases of PPE to Missouri hospitals, healthcare centers, and EMS agencies. I continue to receive calls from fire and law enforcement, and I will tell you we continue to order and check on shipments, but we have yet to ship out significant quantities to fire or law enforcement. We are working feverishly to get the needed supplies to those officers and firemen as they assist our communities with COVID-19. Thank you.
Thank you, Sandy, for that update. As I said yesterday, COVID-19 is having a serious impact not only on public health, but also our economy. Up until this point in my administration, we have been very fortunate to have a booming economy with record low unemployment and wage growth. Incomes have gone up, taxes have gone down. We have, at many times, had more jobs available than we've had people to fill them. Because of this, we have been able to focus on skilling up our workforce and making necessary investments in infrastructure. During these times, we have also been able to put forward responsible and conservative budgets to the General Assembly. Last year, we were able to leave $100 million on the bottom line in order to respond to any unexpected revenue declines. We also propose to do the same for next year, ensuring another year of responsible state budgeting and savings. The General Assembly has also shown great restraint and leadership in passing conservative budgets, and by working together, we have been able to ensure that our state is financially sound. However, the impact of COVID-19 has already been hard felt in our economy. More people are staying home. Business operations have been limited. Many people have lost their jobs, and state revenues are down. When we began this year, we anticipated economic growth, and we had based our budget on that growth. COVID-19 has had serious impacts on our anticipated economic growth, and now we are expecting significant revenue declines, some of which may be larger than those experienced during the Great Recession. While we still do not know the true impact of COVID-19 on the economy, we do know that we have to act now. Between now and June 31st, we are estimating over $500 million shortfall. We have had to take a hard look at our budget and make some very difficult decisions to ensure our budget is balanced and we have the funds to combat COVID-19 going forward. We are planning to restrict $180 million in spending. In the future, we may have to restrict even more, depending upon how extreme the economy impacts of COVID-19 become. In addition to the $180 million we're restricting in the budget, we are hopeful we may be able to use an additional $315 million in federal funding this year to help with this shortfall. However, doing so still may not be enough to solve the problem. Of the $180 million being restricted, I want to assure you these restrictions are absolutely necessary, and they include funding for several departments, many of which are priorities of my own administration. These restrictions include reduced funding for the Department of Higher Education and Workforce Development, the Department of Transportation, the Office of Administration, the Department of Natural Resources, and the Department of Economic Development. In addition, the Judiciary and the Secretary of State have worked to identify savings in their own budgets. Moving forward, we know our departments will be significantly impacted as well, including the Department of Elementary and Secondary Education. We will continue to work with our schools, higher education institution, and congressional delegation to identify additional federal funding to help with any shortfalls we experience. We will also continue to advocate to the White House delegation for federal funding to help reduce the economic impact of COVID-19 in Missouri. Like I said, they are not easy decisions. Just as families and businesses have to balance their budgets and make hard decisions, we're doing the same. This is the right thing to do, to make sure our budget is balanced and we are financially prepared to deal with the far-reaching impacts of COVID-19. Today, our State Budget Director, Dan Hogg, is here to provide some more details on the state budget. Dan?
Thank you, Governor. Just wanted to provide a few more details to what the governor said. We are being proactive in restricting $180 million. We need to be able to do that right now so that we have cash available to buy the needed supplies to fight COVID-19, things like the personal protective equipment, ventilators, and other necessary supplies. In many instances, the state has to provide upfront funding, and so we need to make sure that we have the general revenue available to make these purchases, even if they are later to be reimbursed from the federal government. We are seeing unprecedented drops in revenue from the significant reduction of economic activity from people staying home. We feel like this is going to impact the budget not only for this year, but for next year. This is going to be a multi-year issue that we're going to have to deal with, and we will. We have put plans in place to make sure that the fiscal year 20 budget is in balance, and we will be working on ways to make sure that we are able to provide the needed state services for all Missourians. And we're also working on the upcoming FY21 budget to make sure that that budget is fiscally sound, even in the face of these economic contractions. We are also working with the House and Senate on a bill for supplemental funding for this current budget to make sure that we have funding in place to take care of all of our COVID-19 needs, and we appreciate the House and Senate for working with us on that bill. Thank you.
Dan, thank you very much for the update on the budget. Let me just say an example of what we're dealing with here on the state level. No different it is on your local communities with people trying to get the PPE gear and some of the things. Just a little over a week ago, we made an $18 million purchase on PPE equipment and things for our first responders and for our hospital personnel out there. As of today, that same order will cost you now over $30 million. Every day, that's what we're struggling with. Every day, 24 hours a day, we're trying to figure out how we get this material. But again, the demand out there right now, it continues to be a very strong demand, and we have to be very aggressive every day trying to get what we can to make sure our frontline employees, our first responders, can get the PPE gear they need. We're deeply concerned about that every day when we talk about firefighters, we talk about police officers, we talk about other people in those situations. I just want everyone to know we're doing everything we can to get that in there possible. So we will continue to do that. So, Kelly, we got a few questions today.
I do. The first one, Governor, is for you, is from Bridget Lavelle from KY3. The city of Springfield says auto dealers are non-essential. However, there's a state guideline for car dealers where they have to be open and work a certain amount of hours in a day. The city reached out to the state to ask if they will waive that requirement during these times, and they haven't heard back. So early this week, sent letters to the auto dealers saying they could stay open until they heard back from the state. Can you speak on that?
Yeah, I think every day we're looking at the possibility of waivers across the state, whoever it is. I think the problem you get into, and I think it's going to continue, could even get worse, when you start picking and choosing which businesses are essential and which are not. Because the guy that owns the business, I'm sure, thinks his is essential. The guy that works there that makes a living and gets a paycheck and has to go home probably thinks his job is essential. I think these are the challenges you face when you start picking and choosing which businesses can stay open and which cannot. On Friday, I will address that issue more when we update our order for what we're going to do in the future here in the state of Missouri.
Okay, thank you, Governor. This next one is for you as well. Brian Hosworth from MissouriNet. Governor, Easter Seals Midwest serves about 5,000 children and adults with disabilities, including autism. They're considered essential and continue to go into homes, but tell me their applications for personal protective equipment have been denied and that they need masks, gloves, and gowns. What can be done to get that equipment to them?
Let me first just say thank you for all the people that are doing that job and going into those homes. It's the same thing I just answered a while ago. There is a tremendous amount of shortage on the PPE gear. I think the good news on that, there's a lot of Missouri companies that are stepping up and starting to make this gear for people. And I do believe in the near days, that in the weeks, we're going to have more supplies to be able to get out there to a lot of frontline people that are having to do their jobs, having to go into people's homes, and to be able to help get that PPE gear to a lot of different people. But right now, the priority is the medical staff that's dealing with the COVID-19 on a daily basis, The second wave of that will be through our law enforcement, our nursing home personnel, things like that. But again, it's just going to be a while before we can get that supply. But again, I want to thank the Missouri businesses for stepping up, helping with that. And I think you're going to see a significant increase, the people that here in the state can do once we get them online and they're fully in operation.
All right, Governor, this one is from Sebastian, KBIA in Columbia. The governor said yesterday that he's monitoring cases by county, but people aren't necessarily getting treated in their county of residence. Is there a danger without a statewide shutdown that hospitals could get flooded by patients from rural areas who don't have access to care in their counties?
Yeah, I think that's always a concern. We know if you live in rural Missouri, more than likely you're probably going to go to an urban area to hospitals in a lot of cases. Are we worried about small towns with a clinic there being able to handle that? Yes, we are. But the reality of it is, and again, I'm going to go into that more detail on Friday, when you look at how many cases are across the state of Missouri and how many counties that don't have any cases, how many have one, and how they operate that. But do I think just because you live in rural Missouri, you're going to flood the hospitals in the urban areas? I do not think that. I think that's part of the operations that we've been through, and I think we're going to be able to handle that. Every day when we're making plans here for additional bed space, the bed space is for whoever needs them with COVID-19, regardless where you live or where you're from. But we're looking at that data every day to know what bed spaces we have in this state, where those beds are going to be, who's going to utilize those beds, how long they're going to be in them. But I think on Friday I'm going to do a much more detailed report of where we are in the state of Missouri, who's actually utilizing this, how many people are in hospital beds with COVID-19, what's the rate, the percentages that we have with the people who are testing for the positive, and how they're really affected. Because I think the people of Missouri needs to know a lot of that information. So we'll be discussing that further on Friday.
All right, the last question for you, Governor, is from Sebastian again from KBIA. Is the state planning on providing any immediate financial assistance to rural hospitals and clinics that have lost huge amounts of revenue by following CDC guidelines to suspend elective surgeries?
Yeah, you know what, for whatever the reasons might be, whether it's elective surgery or whatever the reasons are, we're fully aware of that, and we're trying to look to figure out what we can do to help with that cash flow situation right now for the hospitals across the state. But I do think there's going to be resources for the COVID-19 if it's affected by that. There'll be at a time, I think you'll get some refunding done by that. I don't know what that is from the federal level and how we're going to backfill at the state level right now with what you just heard on the budget. But I think we're well aware of that, and we want them to keep their doors open. And I think we got some people out there right now trying to figure out how we maybe can make some payments a little earlier with what we got on the Medicaid reimbursement side and how we deal with that for the non-insured people that are out there. But it's a huge concern. And those rural hospitals out there, no matter whether you're rural or urban, anybody can start having cash flow problems. When I mentioned a while ago, when we're buying PPE equipment, you know, that $18 million, that $30 million I'm talking about has to be paid up front before you get anything, before they even take your order and ship anything. So those hospitals are trying to buy PPE equipment and things for them in the same situation. So we're aware of the cash flow problem. We're going to do everything we can to help with what we can do.
Okay, these next couple of questions are for Dr. Williams. Dr. Williams, this is from Ashlyn O'Hara, the Columbia Missourian. She'd like to know, has the positivity rate for state labs changed from 10%?
It has. Right now, actually, we're about 11.5%. We've done over 1,000 tests in our state lab. We're approaching 20,000 tests overall with our commercial and academic partners. We're right at about 8 to 9% for them. And just want to say again, thank you for your question, but none of those numbers happen without a lot of effort. And as the governor's always said, we'll get through this because of our people. So incredibly appreciative to the people at the Department of Health and Senior Services, not only in our lab, but throughout. We've got people working 24/7 now to make that happen. And I also just want to thank the people in our local health departments. They are doing a phenomenal job. They have names like Clay and Rex and Spring and Emily and Fred. And they're getting a brunt of this. We also have people in our smaller health departments. Kelly and Christy come to mind. There are a lot of others who are working really hard overtime to make sure that people get tested and that they also, if they turn out to be positive, learn as quickly as possible. And we're incredibly appreciative to them.
All right, the second question for you, Dr. Williams, is from Bridget Lavelle from KY3. Many viewers are asking that you list not just the number of people who have COVID-19 or the deaths, but the number of people who have recovered. Many counties have this information, but not the state. Will you be adding that information soon?
We will. As the governor said earlier, it's incredibly important to him that we be as transparent as possible, that we think education and giving out facts and data really help decrease anxiety. So starting on Friday, we will release the throughput of those patients who are admitted, those patients, how long they stay in the hospital, and the severity of their condition. The CDC released yesterday that when you look, sadly we've had 18 people pass away here in Missouri, and our thoughts and prayers go out to their families. But our trends, I look at them, parallel what the CDC is finding nationally, which is that, again, it has always be true, but usually it's in older Missourians who have either chronic lung disease, diabetes, or heart disease.
Okay, thank you, Dr. Williams.
Thank you.
This next question, I've got one for Director Hogg. This is from Philip Sitter, News Tribune. If the pandemic peaks in Missouri sometime this month and social distancing measures could be eased in the month or two after that, how long do you think it might take for the state's budget and projections about it to get back to more or less what they were earlier this year? In other words, what is it at this time a best case scenario for the regular state budget, and how long might it take for the state to get there?
Well, we're in unprecedented economic times right now, and we're working very hard to figure out exactly what that's going to do to our revenues, but I do think that this is going to affect our state budget, not only here in FY20, which ends June 30, but I think it will affect our budget all of fiscal year 21, which goes through next June 30, 2021. So we think this will be an issue we'll be dealing with in the budget at least through FY21, maybe even a little bit longer than that. But we will put a plan in place that makes sure we have a balanced budget that delivers the essential services all Missourians need.
Thank you.
Let me just finish making a comment on what the director just said there. You know, it's going to be tough for the state budget, as Dan just said, for 2021. But let me just say this too. I do believe this is not going to be like a normal recession where we have a trending to go down and it's over a long period of time. I do believe when we get past the COVID-19 situation, the economy is going to have a much better chance of coming back at a lot quicker pace than normal. I think a lot of those jobs will be out there. I think the supply and demand will be there. And I think we got to be prepared for that. But it's just going to take a while to get through this situation, and we have to prepare for that every day. But I do believe the economy will come back. It'll come back strong once we get through this, and hopefully the sooner the better. I hope it's in the third and the fourth quarter of next year. I truly do. And we're going to be watching that. But for right now, everybody's got to do everything they can right now. Government has to do everything they can to survive right now. People at home need to do everything they can to survive right now. And we're just going to have to deal with this for several months until we get into the budget process. So, as I've said many times, the COVID-19 situation changes every day. Every day, we are constantly reevaluating and looking at all possible options. But again, the most important step anyone can take right now is staying at home. No matter where you live or how old you are, everyone should be staying at home as much as possible. By not following these orders, you're putting yourself, you're putting everyone around you at risk. We need to get rid of the mentality that people are stuck at home. What you really are is you're safe at home. So for the sake of all Missourians, be smart, be responsible, and stay at home. Thank you, and God bless.